So ankle replacement is a technique for replacing the ankle joint. Most people are aware of hip and knee replacements, which have been around for many years. Ankle replacements are a newer technology that's been developing a lot recently and which have become more and more reliable over time. So it's a way of taking away the pain from arthritis in your ankle and changing over the inside of the joint for some metal and plastic components that allow you to use your ankle and for it to move. So ankle replacement is most commonly needed for osteoarthritis in the ankle joint. Now, unlike a lot of other parts of the body, most commonly ankle arthritis develops after an injury. So often people will have had sometimes a broken ankle, or sometimes just involvement in a car crash or something similar in the past, which then causes ankle arthritis. That if it's not painful, doesn't necessarily need any treatment, and there are some other good treatments available, such as sometimes if it's very early, then keyhole surgery of the ankle, or indeed ankle fusion. But ultimately, if the arthritis is severe and very painful, and if other treatments have failed, then ankle replacement becomes an appropriate option. Some other patients also have other conditions such as rheumatoid arthritis or psoriatic arthritis. Hemochromatosis is another, where they can develop painful arthritis in the ankle and may need to then consider an ankle replacement. So the advantage of an ankle replacement is really that the recovery is slightly easier, and indeed the joint itself moves, and that's of a particular advantage if the patient has arthritis elsewhere in their foot, in which case the stiffening effect of a fusion then puts more force onto the other arthritic joints. They are both treatments very good for ankle arthritis in general. And indeed, it's only in recent times, as the ankle replacements have become more reliable, that really the niche for successful ankle replacement has really opened up. And it's as a result of the newer technologies that we have, such as patient-specific 3D printed cutting blocks to accurately guide the operation, that we're able to offer more replacements these days than perhaps we did in the past. After an ankle replacement, most people have the surgery under either a general anaesthetic or a spinal anaesthetic. It is possible to go home the same day as an ankle replacement, although most patients stay overnight. You would then need to spend around 2 weeks in a plaster cast without taking any weight on your ankle. And at the end of that time, I would tend to change patients into a boot and allow them to walk. By the time I see people at 6 weeks, they're usually walking fairly comfortably. They're not back to doing all the things they were doing before, and that really happens over the few months thereafter. But most people can get out for a short walk at around 6 weeks to 2 months, and that progresses fairly rapidly over the month or so after. And the other thing is that the replacements do carry on improving. So over time, over the 3 or 4 years after surgery, often things carry on improving, and even some of the more minor symptoms and troubles that a replacement can give tend to improve over time. The National Joint Registry in the United Kingdom suggests that around 3% a year of ankle replacements will fail over time. So it is only a fairly small proportion of replacements that ultimately need any further work. But that said, the technology for revising failing ankle replacements has also come along apace in the last few years, and that's really made a difference to the small proportion of patients that do ultimately need a further surgery.